Welcome, everyone, to our presentation on senior blues. All information in today's presentation comes from the National Institute of Aging and Mental Health of America. My name is Kelsey Casper, and I am the new program assistant for the older adult team here at the Southwest Council. Southwest Council is a nonprofit private agency that was established in 1991. We provide prevention, outpatient, intervention, and educational services. We have offices located in 3 local counties. They are Salem, Cumberland, and Gloucester. If you would like to inquire about any of our above services, please call 1-800-856-9609. Or you can look at our official website, www.southwestcouncil.org. Another way to see what's happening here at the Southwest Council is to look us up on Facebook. So what is depression? Depression is more than just feeling down, out of sorts, or sad. It's a mood disorder that causes change in daily activities such as eating, sleeping, hygiene routines, and working. In addition, it can affect the way a person feels and thinks. Depression can cause individuals to have trouble with daily life activities for weeks at a time. It's more than just feeling sad for a couple days or in a funk. Depression is a real diagnosis and illness, usually referred to as depressive disorder or clinical depression. Like all illnesses, treatment is recommended to help with depression. It is not something people can push through or snap out of or force themselves to be better. It's not a matter of will. It's a matter of getting help. Often, older adults think depression is just a part of aging and that it's normal. But although it is common, it is far from normal. Your concerns need to be addressed and need to be treated. If you are thinking about harming yourself, do not isolate. Call your doctor. Ask a loved one for help, or call the National Suicide Prevention Lifeline at 1-800-273-TALK. Call 911 or go to emergency room for immediate help. Life changes can easily trigger sadness and anxiety. It's okay to feel sad. Depression is more than that. After losing a loved one or a significant life change like retirement or a diagnosis of a serious illness or life-threatening illness, it's okay to feel sad. But after an adjustment period, if homeostasis is not found, depression can develop. There are several types of depression: major depression, persistent depressive disorder, psychotic depression, postpartum depression, season affective disorder. But the 2 most common in older adults is major depression and persistent depressive disorder. Major depression is severe symptoms that interfere with a person's ability to work, sleep, study, eat, and in general, just enjoy their life. An individual may only experience one episode of major depression in their lifetime. However, people often experience several episodes throughout their lifespan. Persistent depressive disorder is a depressed mood that lasts at least 2 years. A person with persistent depressive disorder may also only experience one 2-year episode in their lifetime, but they may experience several episodes as well. Approximately 2 million adults in America aged 65 and up experience depression every year. 20% of all suicide deaths are of people over the age of 65 in the United States. 55% of older adults struggling with depression are treated by their primary care physician. Only 3% of older adults struggling with depression are treated by a mental health professional. 80% of older adults with depression are successfully treated for their depression. So what are the causes and risks of depression? Well, there's no one cause or one risk that guarantees that you're going to have depression. But here are some things that put you at a little higher risk. Your genes. A family history of depression makes an individual far more likely to develop it than those who have no family history of any mental illness. Personal history. If you have been diagnosed with a mental illness or depression at some point in your life, you are more likely to develop it as you proceed into your senior years. Brain chemistry. A chemical imbalance may be the cause of your depression. Chemical imbalances can occur naturally or because of medication. They can also occur by the misuse of drugs and/or alcohol. Stress. Stress is another major trigger of depression. Losing a loved one, a strain in a personal relationship, becoming the main caretaker of a loved one, or other life changes are all triggers. Examples of life changes could be retirement, divorce, or a move. And it's important to remember that not all life changes have to be bad to be a trigger. Illness. There's a specific type of depression called vascular depression that affects the blood flow to the brain. Lack of blood flow can cause this kind of depression. Other illnesses can easily co-occur with depression. This can be because of the gravity of the diagnosis, the change in life because of the diagnosis, or a side effect from medication. An example of a diagnosis that may change your life, but is not necessarily life-threatening, could be diabetes. You will have to insert checking sugar levels and diet changes into your everyday life, and that at times can feel overwhelming. and could be triggering. Some miscellaneous factors that also put people at higher risk for depression are being female, poor sleep quality, social isolation, chronic pain, and loss of mobility or independence. These things can easily get you down and spiral you into depression. So, signs and symptoms. How do you know that you or your loved one are experiencing depression? The feeling signs and symptoms. An individual struggling with depression may experience feelings such as sadness, emptiness, anxiety, hopelessness, guilt, worthlessness, irritability, anger, restlessness, disinterest in one's pleasurable activities, tiredness, forgetfulness, feelings of being overwhelmed, dread, constant tension or nervousness, uncontrollable panic, and detachment from your physical self or your surroundings. An example of detachment from your physical self or surroundings could be just feeling very foggy and non-existent in where you are. Some behavioral signs of depression are when a person avoids objects or situations that might cause them anxiety, avoiding eye contact, difficulty making decisions, canceling plans frequently, not participating in conversations or activities that a person once enjoyed or did, self-isolation, neglect of responsibilities, neglect of hygiene and other daily routines. This could be showering, cleaning a person's house, paying bills, and other daily routines. Withdrawing from family and friends, difficulty getting motivated in the morning or getting out of bed, behaving unusually. And that is very vague and large, but we know ourselves and our loved ones. So if something is off, look for other signs and symptoms. Denial of depressive feelings. There are physical changes and signs and symptoms as well. And I think people don't often realize that there is a physical disturbance when someone is struggling with depression. You may notice a slowness in an individual's movement or speech that is not tied to any medical disorder. Nausea, loss of appetite that could lead to weight loss, increase in appetite that could lead to extreme weight gain, increase in pain, such as headaches, cramps, and aches, vomiting, suicidal attempts, frequent crying, muscle tension, increase in sleep, or decrease in sleep. Common thoughts that occur when a person is experiencing depression are, I'm going crazy. I am worthless. I want to die. I am a failure. Life's not worth living. Nobody loves me. They'd be better off without me. I am a burden. A person may also be plagued with nightmares, have extreme memory loss for no explained medical reason, and other intrusive thoughts. So if you or a loved one are experiencing these things, please know that depression is treatable. It's important to discuss your options with your doctor and ask for help. There's therapy through mental health professionals. Some examples of therapy is psychotherapy and cognitive therapy. Psychotherapy is frequently referred to as talk therapy, and it's a way for people to discuss and process their feelings with a mental health professional, such as a therapist, psychiatrist, or counselor. This type of treatment can vary in time. It can be anywhere from a couple weeks to months to years, depending on an individual's needs. Cognitive behavioral therapy is when the therapy is focused on changing negative, intrusive thoughts and behaviors that an individual is experiencing with a mental health professional. Medication. Doctors may reassess your current medications to see if depression is a side effect of what you are currently taking. Doctors may prescribe an antidepressant to help balance certain chemicals in your brain and also help balance your moods. It typically takes about 2 to 4 weeks to make a difference in your depressive symptoms on medication. Never stop taking any medication without discussing it with your doctor first. All medication should be taken as prescribed. Medication is best used in conjunction with therapy. There's other things that are known to help depression, but they are not to be used instead of speaking with your mental health professional or your doctor. These activities are thought to work best when working with your prescribed therapy. Yoga or meditation is known to help improve mood disorders. Light exercise, such as walking, is known to help improve mood disorders. Spending time outdoors in direct sunlight can help. Spending time with loved ones, discussing your feelings, or just bonding with them. And re-engaging in activities that you once enjoyed despite the lack of interest as of lately can help. Lastly, eating a balanced, healthy diet can assist in your depression improvement. So what are some resources? When in doubt, please ask for help. If you're contemplating suicide, please call 911 immediately or go to your local emergency room at your hospital. If the prospect of finding a counselor seems overwhelming, call your primary care physician. They can help guide you, recommend you, or help find a proper medication to help with your depressive mood disorder. There are also several hotlines or helplines that are 24/7 that you can call to talk your feelings out. The National Suicide Prevention Lifeline is open 24/7, and their phone number is 1-800-273-8255. There's also a 24/7 stress line for you to call and speak to a real person about the feelings of stress that you are experiencing in your life. 1-800-843-5437. Please remember that you are worthy. Depression is common, but it is not normal, and you deserve help. Thank you for listening to the Senior Blues presentation. My name is Kelsey, and have an amazing rest of your day.